In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Impulse control disorder. So under impulse control disorder, it is nothing but a feeling of increasing tension. So you have increasing of the tension and as well as the arousal that leads to the performance of a certain act. So performance of the certain act. Next is an impulse control mechanism, impulse control disorders. There is an irresistible impulse. So there is an irresistible impulse or urge. The irresistible impulse or urge to perform an act. That is, it gives a sense of relief and gratification. So there is sense of relief and the gratification in a short term. Then comes which is harmful to the self. It is harmful to self or the others. So they may cause a marked distress about the behavior. So there is a marked distress about the behavior. So the examples being, there is pyromania. So pyromania is present with fire. So there is a recurrent proposal setting of fires or absence of a clean motive. So this is the pyromania is for the fire. Next is kleptomania. Kleptomania is recurrent stealing of objects that are not needed for the personal use or for the monetary use. This is kleptomania. That is a recurrent stealing. Then comes intermittent explosive disorder. Intermittent explosive disorder. Intermittent explosive disorder is characterized by the recurrent brief episodes of verbal and physical aggression. So you have a verbal and the physical. Verbal and physical aggression or the destruction of the property destruction. So all this is seen in impulsive explosive disorder. Then comes the compulsive sexual behavior disorder. The compulsive behavior sexual disorder is nothing but an ICD. It is ICD 11. It is included under the impulsive control disorders. So this is characterized by the persistent failure to control intents. So persistent failure to control the intents, then the repetitive as well as the sexual impulse. So you have the intense, repetitive and the sexual impulse. Then comes the repetitive sexual activity. So repetitive sexual activity is present. This becomes the focus of life. This is the focus of the life and results in the adverse life consequences. Adverse life consequences. Now looking at impulse. So impulse, you have control disorder not otherwise specified. So control disorder not otherwise specified. So that is the residual category. This includes the recurrent episodes. There are recurrent episodes of buying despite the buying behavior. So causing the significant monetary loss. So you have the monetary. So you have monetary loss and the socio-occupational distress. So you have the monetary loss, socio-occupational distress. So the example here is nothing but the compulsive buying. Compulsive buying can be an example as well as the internet addiction. It is also an example. Now, how do you treat this impulse control disorder? The treatment is by you have a cognitive behavioral therapy, cognitive behavioral therapy, and there is also the pharmacotherapy. Cognitive behavioral therapy, pharmacotherapy, it is nothing but the antidepressants. So antidepressants like the SSRI. So you have the antidepressants like the SSRI, that is, it includes the valproate, the carbamazepine, as well as the presence of the lithium. To learn and grow daily like this, please do subscribe.